Hello friends, this is our third video in the Pediatric Radiology series. We have received very good responses and comments on our previous two videos in the series. So, if you have not watched those two videos, please watch the part 2, how to read a chest x-ray, and also the part 1, which we have already covered, where we have discussed mainly chest x-rays, which is essentially the 90% of your whole of the radiology viva. However, extremities x-ray, skull x-rays and abdominal x-rays are also important, and first one must know the important findings and how to recognize them. So let's get started. To make the video more interactive, I would like to I would like you to observe the shown x-ray. Then you can pause the video for 10 seconds. Think about the diagnosis and then you can resume the video. So here is the first x-ray for you. You can pause the video here and think about the abnormality. To make it easier for you, let's have a look at the normal x-ray also to have a comparison. Can you guess it now? Yes, it is a classical x-ray showing classical features of Rickets, that is cupping, splaying, fraying, right? Cupping is the increased concavity of the metaphyseal end, while splaying is the widening of it. Fraying refers to the irregular margin of the metaphyseal ends. All these changes are seen due to weight-bearing effect on poorly mineralized bone due to vitamin D deficiency. Great. Let's have a look at another x-ray. You can pause the video here. So what is the abnormality? It is a slightly difficult x-ray, and the abnormality here is the proximal tapering of the metacarpal ends, and this is typically seen in mucopolysaccharidosis or MPS. So if you are shown a wrist x-ray, chances are that most likely it will be either Rickets or MPS. The other classical feature of MPS is seen in the spine. Can you appreciate? This is the anterior beaking of the vertebral bodies. So these are the two classical features seen in mucopolysaccharidosis. Okay, now let's see another classical x-ray. So what is this? Yes, this is a classical hair on end appearance, and it is seen in chronic hemolytic anemias like thalassemia, sickle cell anemia, hereditary spherocytosis, and even chronic iron deficiency anemia. And this appearance of long, thin, vertical striations of calcified spicules perpendicular to the bone surface within the diploic space is a result of increased bone marrow activity in response to chronic anemia. Okay, let us see another skull x-ray. Can you guess the diagnosis? So this is classical copper beaten appearance, and the name is because the skull appears as a beaten copper vessel. This finding is classically seen in the conditions with raised intracranial pressure. Great. Let's have a look at another skull x-ray. What is the abnormality here? Some of you may have guessed it. It is the lytic lesion in the skull. Can you appreciate it now? Lytic lesions can have multiple differential diagnoses, and the most common being Langerhans cell histiocytosis, metastasis, osteomyelitis, the burr hole craniotomy, dermoid or epidermoid cyst, and sometimes even hemangiomas can give an appearance of lytic lesion on a skull x-ray. So from the skull x-ray, let's move to one of the commonly shown extremity x-ray. So what is this? Yes, it is a classical x-ray of scurvy or vitamin C deficiency. So what are the classical features? You can appreciate the pencil thin cortex. Another classical sign is the Wimberger ring sign, that is ring-like margins of the epiphysis. Another classical sign seen in scurvy is Frankel line or white line of Frankel, which is a thickened irregular white line seen at the metaphysis representing zone of well calcified cartilage. We also can appreciate the tremor field zone, which is an area of rarefaction underneath the white line of Frankel. This area represents debris of broken down bone trabeculae and connective tissue. This is also known as Scurvy line. Finally, you can see Pelton spur, which is a lateral projection of white line seen at the cortical end. So this is an X-ray of advanced scurvy where you can see all the classical features which were shown in previous X-ray as well. But you can also appreciate the subperiosteal hemorrhage, right? This is subperiosteal hemorrhage. Okay, so now let's have a look at some of the important abdominal radiographs. So what is this? Here you can appreciate two distinctive gas bubbles. Here these are. So this is known as double bubble appearance, right? So what does it mean? It means that gas is unable to pass beyond duodenum, which is a feature of duodenal atresia, right? Similarly, a triple bubble appearance can be seen in jejunal atresia. Okay, let's see another abdominal X-ray. Have you guessed it right? This is a classical finding known as pneumatosis intestinalis, which means gas in the bowel wall. So gas inside the bowel lumen is a normal finding, but when mucosa become fragile, there can be gas inside the bowel wall as well, as can be seen in this X-ray. Can you appreciate it? So this is the gas in the bowel wall, right? So there is this black outline of the bowel wall, which is even better seen in the transverse cuts, For example, seeing this target sign kind of appearance is very classical of pneumatosis intestinalis, and this is typically seen in necrotizing enterocolitis in premature babies. Well, another classical feature of NEC is portal venous gas. Can you appreciate the gas in the portal venous system? This is the gas shadow, right? So okay, let's see one more finding of the abdominal X-ray, and this is nothing but what is seen in advanced necrotizing enterocolitis. Yes, this is air under diaphragm, and it is a characteristic feature of intestinal perforation. Well, this is a must-know X-ray for every medico, and you just can't afford to miss this. Okay, till now we have covered almost all the usual X-rays which are commonly asked in exam. Now we can have a look at few of the advanced radiograph which can be asked only if you are doing very good in exam. So let's see next radiograph. What is this? So you can obviously appreciate the dye in this X-ray. This is MCU or micturating cystourethrogram. This is done to look for the vesico-ureteric reflux or VUR, mainly in the patients who are coming with recurrent urinary tract infection. Okay, so this reflux can be graded as shown in this diagram. So there are 5 grades. Grade 1 is when the urine reflux or the dye reflux only up to ureter. Grade 2 is when the dye reflux into the ureter and pelvic ileal system of the kidneys, however there is no swelling. In grade 3, the kidneys, the pelvic ileal system has minor swelling. In the grade 4, there is moderate swelling, and in the grade 5, there is severe swelling with the twisting of the ureter. The ureter become very tortuous, right? So these grading may even be asked as shown in this. So this is grade 4 or grade 5, right? On the left, on the right ureter, you can see it has become tortuous. So right side it is grade 5 and on the left side it is almost grade 4, right? So this is also a micturating cystourethrogram but showing a different finding. Can you appreciate the finding in this? Here there is no reflux in the ureter or the kidneys, but rather posterior urethra is dilated, right? So this is seen in PUV or posterior urethral wall. So if you do ultrasound of this patient, then you get this kind of picture, and this is called keyhole sign, which is another diagnostic feature of PUV. And it can be seen in both antenatal and the postnatal ultrasound. Okay, so let's see the final X-ray of this video. What is this? So this is called Erlenmeyer flask deformity, right? Because of the appearance of bone as a flask, because of thinning of the diaphysis and widening of the metaphyseal end. And this is seen in disease like Gaucher disease, Niemann-Pick type B disease, sickle cell disease, and even chronic lead poisoning. So friends, that's it for this video. Thanks for watching, and if you have find these videos useful, then do like and subscribe to the channel. Bye.